ADHD isn't a brain issue. It's a whole body issue. It's an issue of whole body toxicity and or dysfunction. So we need to treat and fix the whole body, and through finding the root causes in each person. So certain practitioners and people believe that ADHD and or autism are just a different type of normal, and people are just built differently. So and there's nothing to treat, there's nothing to fix, there's nothing we should be actually doing, which I just find utterly insane. Myself and certainly many other naturopaths and nutritionists, we're very holistic. We look at everything. We look at someone's diet, we look at someone's lifestyle, we look at their environment, and all the toxins and chemicals, everything that someone potentially could be exposed to that could be contributing to their physical and or their mental health issues. But I think part of the problem is too many health practitioners are very siloed and very specialized in their little areas. No biochemical testing in the official diagnosis. There's no blood testing, there's no hair test, there's no what's going on in the body, trying to find what's going on in the body, trying to find organ and tissue dysfunctions, etc. So there's no testing that's typically done, but actually should be done, because they can give huge clues, as I said, to the root causes and or the dysfunctions that need to be addressed as well. So many of these toxins and chemicals do build up in the body over time, so the problem can become bigger and bigger over time. The stomach is a huge, big problem. So if the stomach isn't working very well to digest foods, to break them down and release the protein, the vitamins, minerals, etc., then you're going to have a reduced absorption of those nutrients, which then results in nutrient deficiencies, which then results in nutrient deficiency symptoms. If we provide the body with all the nutrients that it needs and improve the environment that we're in, or that the person is in, yeah, absolutely we can turn chronic health conditions around and reduce symptoms and get people back to health again. And that includes things like ADHD and autism. And we know that all medications cause side effects, and many of the actual ADHD medications actually make the ADHD symptoms worse, so or unrelated mental health or neurological symptoms worse. So, for example, anxiety or depression, they're actually not part of the official diagnosis of ADHD, which I just find insane. But just about everyone with ADHD has depression or anxiety or both, but it's not part of the official diagnosis or guidelines.
So it must be incredibly rewarding to see a patient come in who has ADHD and go out the door, we'll say, neurotypical child, and be able to function in society without the symptoms of ADHD.
Yeah, it really is, and especially when certain elements of the practitioner community and the health industry generally, and certainly medicine, that basically says there's nothing you can do. It's a lifelong issue, and there's nothing you can do other than just take this medication.
Hello, everybody. Welcome to Health Alliance Australia's podcast. My name is Jeannie Rose Angewartha, and I'll be your host today. Health Alliance Australia is a leading health advocacy organisation dedicated to honouring bodily autonomy and well-informed health choices. For those of you who have recently joined us, we have had some amazing guests that have shared their experience of knowledge, from bioweapons, prions and mind control technology to alternative health practitioners discussing healing modalities and avoiding being poisoned by popular drugs and supplements, to childbirthing out of the system, the importance of light to health and blue light toxicity, to releasing trapped stress and healing on the atomic level, government poisoning programs, and the importance of correct breathing to health. Please go to our channel and check all these videos out, especially the latest one with Trevor Hold on the Toxic Fire Ants program. Now, our guest today is Ross Walter. He's a nutritionist and naturopath and herbalist. We are very honored to have him. Thank you, Ross, for coming today. If you would, please share a little introduction about yourself.
Oh, and thank you very much for inviting me. It's a pleasure to be here. So I am, as you say, I'm a clinical nutritionist. I'm a naturopath and herbalist as well. I'm based in Brisbane, Australia. I see people all over the country and even overseas as well. I have a particular area of interest or specialty, especially around mental health, but complex and chronic cases in particular, but certainly mental health is the main area that I see. And I approach mental health and any other complex and chronic issue with a different viewpoint, especially to the medical system. So doctors and the medical system are about treating the symptoms and reducing or treating symptoms, typically with medications, for example. So they'll say, "Oh, you've got this diagnosis, here, take this pill." But all medications do really are just hide the symptom or pretend that it's not there, and they don't. The medications don't address the root causes of why you have those symptoms or issues in the first place, and doctors don't try and find what those root causes are. They're all really just about managing the symptom with medications. So my focus and my belief in the way that I work is that I can turn symptoms and conditions around and get people back to health again.
Wow.
But only if I find all of the root causes and all of the root causes in each individual person, because I can line up 100 people with obviously the topic of the day being ADHD. They're all going to have a different combination of root causes. So to find the root causes in each person, and then to treat and fix those root causes, we're going to get a much more personalized approach and a
Yes.
much more personalized treatment plan, rather than just here's the same medication we give everybody for the same thing, which really doesn't work. And so by finding the root causes in each person and then treating and fixing them, we also get fairly quick symptom relief. Because
Yep.
if we haven't got the same triggers or causes there on a daily basis, of course your symptoms are going to reduce and fairly quickly. But also with finding and treating the root causes in each person, we get the long-term resolution as well. So the problem disappears, long into the
Yes.
future, and even the long-term prevention, so the problem doesn't come back. So I use a combination of different investigations, testing, very detailed questions in the consultations, and I've developed my own unique root cause analysis process to help identify all the root causes in each person. And this might just sound like common sense, but it's actually not the way that we typically as nutritionists or naturopaths are trained. I think we're trained often by the same lecturers who train doctors at their universities as well. And we learn a lot of the same anatomy, physiology, chemistry, biochemistry, and other subjects. But we're still, for the most part, trained to treat individual symptoms, whether that's anxiety, whether that's diabetes, whether that's eczema, or whatever it might be. But the problem
The
is,
whole person.
yeah, rather than the whole person, and that's treating the whole person is really part of our naturopathic principles of treating the whole person, treating the root causes, and we learn the importance of that. But really, our training is not that focused. It's still very much symptomatic focused. And the problem is that no one comes to see me with just anxiety or diabetes or eczema. They come in with all three of those and another dozen other diagnoses and symptoms as well. And I very quickly learnt or understood this when I first started practicing. So I maybe intuitively, maybe accidentally, developed my own process to actually finding the root causes in each person. So that's the way that I work with everyone. so it becomes much more personalized and really specific to the individual. So that's a huge.
So what are the common root causes that you have discovered about ADHD? They're saying what 6 to 8% of Australian children have ADHD now. I mean, whether is that an accurate number, or are we overdiagnosing?
Oh no, it's definitely not even overdiagnosing. I think sometimes some of the statistics I've got on particularly Australian children actually go a little bit higher than that.
Okay.
But at least we're not as bad as some other countries like the US and others. So they're getting into the high teens and close to 20% of children with ADHD. So so the root causes are a different combination in each person, but so there can be some element of genetics there.
Yep.
There is a very high uh, heritability of ADHD and related autism disorders. But we may need
Do you
to.
think that has to do with detox pathways, the person's ability to remove toxins from their
Yeah,
body?
there's a couple of issues with that. So yeah, there's going to be some genetics around that, like methylation pathways and MTHFR genes, things like that. But certainly other genetics as well. But the genetics in what I'm talking about really is the fact that the people with the ADHD and related autism disorders tends to run in families, and uh, this doesn't always mean it's genetic though.
Mm,
People within families tend to learn the same things from
eat the
from
same
their
food.
parents, and then those parents learn it from their parents. So we tend to do the same thing, and that's uh, perhaps have the same diet, and it's obviously a big problem if the diet's not that great, or they have the same lifestyle. So whether the family's sort of grown up drinking and smoking, well, that's going to be a problem that the children and the grandchildren are going to learn as well. So these are not necessarily genetic things, but they're certainly related to
Yeah.
the to the uh, to the family. Um, so there's a lot of elements of that, but
But where there isn't genetics involved, where, say, for a first generation child, where there's no history of ADHD, I mean, there must be other causes and triggers
absolutely,
that,
yeah,
there are various poisons that have been introduced into that child
yeah,
that are major, things that can be prevented.
yeah. So there's a lot of different toxins, chemicals that we're all exposed to on a daily basis in our water, in our food, in our air and environment around us, and um, I have identified in my research that there's many dozens of or more of different types of chemicals, excuse me, that we're exposed to in our environment or our foods, etc. And so many of these toxins and chemicals do build up in the body over time, so the problem can become bigger and bigger over time. So yeah, this is perhaps why it can be advantageous to filter your water. I'm sure we'll talk more about treatments and things later,
Yes.
but and try and reduce your exposure to various toxins and chemicals in food and the environment. So organic foods, for example, certified organic foods, and are going to be a much less of a risk, or near zero risk for those toxins and chemicals. So any chemicals, and we often find these in processed and packaged foods for additives and all sorts of artificial colors and flavors and additives and preservatives. And that's even before we get into the agricultural chemicals that are actually
Yes.
used in the growth or even production of those in quotes foods.
Yes.
As well. So there's a lot of potential exposure to chemicals there as
And
as a root
shampoos
cause.
and soaps
Yeah,
and detergents,
anything that we put on our
air
skin,
fresheners.
anything we put on our skin or we're exposed to in that way, or even breathe, it's going to get into the body, and it's going to cause a lot of different toxicities. I mean, even just shampoos and conditioners and other cleaning products. There's all sorts of hormone disrupting chemicals which are known to actually contribute to or make ADHD worse, and even cancer causing chemicals and other things as well, and not necessarily related to ADHD. But the it's a really broad area, and so many things that really need to be investigated in someone with really any complex or chronic condition, but especially with regard to autism as well. And some of the other, should we say, toxicities that perhaps don't get a bit of a look at or not really thought about. So our lighting, for example,
Oh, yes.
the lighting that we use in our homes or in our rooms, it's not the same as being outdoors in the sun when we're getting the full lighting
Yep.
spectrum. And there are studies showing that like the so-called energy efficient compact fluorescent lights, for example, and other fluorescent lights, LED lighting, and because they've got a very limited wavelength or range of wavelengths in the light, actually can make ADHD worse. So there have been some studies done. One particularly memorable one was in classrooms, where all the lighting in the in this particular classroom, where there was a couple of known ADHD diagnosed children, with all the lighting was changed to a more broad spectrum, more sort of holistic range of frequencies, and the behavioural issues of the ADHD children almost immediately changed.
Mm.
So even to something like that,
And children are getting exposed to so much more computer use, like from very a young age these days, in those
yeah,
frequencies
that's true.
and
That's
the light. Do you find that with your ADHD children patients that they do better
absolutely,
without
yeah. I think
less computer time?
absolutely. I think it's unfortunate a consequence of perhaps our technology age that we're in at the moment, but also perhaps of society in general, um, and parenting um, changes perhaps compared to when we were a little bit younger, when we were children, perhaps. I think how busy parents are these days. Do they are parents really giving their children enough time or supervision or even discipline for that matter, and rather than giving them screen devices and toys and computer games and things like that, because I'm sure it might shut them up and settle them down, and maybe appear to be not so bored with other tasks or things in their lives, but it actually makes the ADHD and related behaviors worse,
Mm.
because of the not just the screen time and the exposure to the blue light from the screen devices, but the dopamine, constant dopamine hit,
Yes.
and the effects on the mental health and moods and behaviors there as well. And then that in turn causes more issues, like with disrupted sleep, which then causes more and more
The
issues
never-ending
and
cycle.
worsening of ADHD, and then just compounds. So the toxicity and of things that we were talking about, it isn't just related to food and water. It is the all of the things that we're exposed to through all of our senses, in all aspects of our environment as
And
well.
of course, we haven't even really touched on one of the major ones of medication and jabs and all the things that are actually put into a child from a very young age, and even to the mother now before the child is even born. So the child is already coming out with toxins
Yeah,
as soon as they're
exactly.
born.
Yeah, from one of the big things that I haven't mentioned, that is a known root cause to ADHD diagnoses and other autism related diagnoses as well, is heavy metals. And there are a couple of known areas where children can be exposed to this, but also um, that doesn't explain why a 1-year-old that I've might have seen as a client been diagnosed with ADHD. How does a 1-year-old or a 3-year-old or a 4-year-old when we test for heavy metals, which is done typically with a hair test or an HTMA or hair tissue mineral analysis test, how can they possibly be showing very high levels of mercury, lead, arsenic, and aluminium and other heavy metals? And one of the sources of all this is actually the mother. So the pregnant mother may have been exposed to all of these things in her 20, 30, 40 years of life, and then have a baby or get pregnant, and then the fetus is being exposed to these heavy metals through the placenta and in the mother, and then basically the baby's already born with heavy metal toxicity, and that's even before we start talking about the heavy metals that are added into the childhood vaccinations, for example.
So it'd be interesting to test the mother really, or women before they're pregnant, almost, to have a baseline as to whether she has got a heavy metal problem, and to remove those heavy metals.
Yeah, exactly. It certainly could be done, and I do see a number of women who come to see me for optimal pregnancies and to get the best outcome. So if I'm looking at that, I would almost certainly have a look at those heavy metals that are there as well to try and reduce that risk. And I'm probably going to say something a bit controversial, probably not the only thing, but I don't know too many other people that are saying this, that if we know what the root causes of ADHD and or autism disorders are, we know what those root causes are, and there's many dozens or more different types of things that we know can cause ADHD or make ADHD symptoms worse, then we can treat and fix those root causes, and we can start to reverse ADHD and actually get someone back to health again, and actually not have that diagnosis anymore. But also, again, if we know what the root causes of ADHD are, we can prevent ADHD.
Yeah. And
I don't know anyone that's really saying that, certainly, or at least openly. But it's true that if we know what the root causes of ADHD are, we can treat and fix and reverse it, but we can also prevent it as well, which I think is...
I find that I know you've said that. I didn't think it was all that controversial, but I think you said that you were chucked out of 2 groups because of your controversial views regarding ADHD. And I thought that this was the whole basis of what health was about reversing or curing diseases, not just management of symptoms. Yeah. So I didn't find that. But do you think perhaps it's down to a whole industry that has created itself around this idea of neurodivergence? That because you've got your speech therapists and a whole heap of other people that are involved into care of a child.
Well, I think some of those industries, maybe some of those health professionals, they're trained to do what they do in the way that they work or the way that they operate. Myself and certainly many other naturopaths and nutritionists, we're very holistic. We look at everything. We look at someone's diet, we look at someone's lifestyle, we look at their environment, and all the toxins and chemicals, everything that someone potentially could be exposed to that could be contributing to their physical and or their mental health issues. But I think part of the problem is too many health practitioners are very siloed and very specialized in their little area. And we could say this of psychologists and psychiatrists, I believe, as well. They're very much focused in just the moods and behaviors of the head.
Okay.
And they ignore everything else in the rest of the body. And they certainly don't go into the diet. They certainly don't go into the toxins and chemicals that people can be exposed to that might be causing these things. They're really just, again, treating the symptom either with medication or other therapies. But while they might give some relief of symptoms while you're taking the medication, but the medications don't fix the root causes of the problem. And we know pretty much all medications cause side effects, which are basically just additional symptoms that you didn't have before you started taking the medication. So I'm not completely dismissing those, because they can reduce symptoms and can give people a better quality of life. But at the same time, we really have to find all of the root causes in each person to truly reverse the diagnosis, or reduce those symptoms, and even get rid of those symptoms.
So when you do a hair tissue mineral analysis, it comes up with obviously varying levels of mercury, lead, arsenic, which will give you an indication of where to look for potential environmental exposure. But I'm sort of interested, and obviously in different deficiencies like iron, zinc, copper, and others. I'm interested to know, like you're saying that people have a different, there's different root causes. And so obviously these tests are all coming up different as well. Is there ever an ADHD case that you've got that the hair analysis didn't show any metal toxicity?
Yes, there has been. I would say it's in the very minimal percentage. I would probably say offhand about 10% of the time they don't have heavy metal toxicity. Hence why it really is important for people either with ADHD or parents of ADHD children, really to get this particular testing done. Because it can find, obviously, one of the biggest causes of ADHD and behavior and mental health symptoms. So by finding the particular types of heavy metals, then we can put a more specific and personalized treatment plan together to address those all of their root causes, including the heavy metals. And each heavy metal really needs to be treated very differently. They all have different ways that they can be detoxed or chelated out of the body, and they all need a specific protocol. And I would generally only work on one of the heavy metals at a time, because it can be just too much, too stimulating to try and work on all of them at the same time. But
your analysis is really to try and locate, to do this is just to try and locate what the chart looks like. What are you using it to analyze?
Yeah, it's partly. I mean, obviously you want to find what the heavy metals are, or what any of the other causes are in each person, but then to go back and find, well, where's this coming from? So we could find potentially where those sources of the heavy metals have come from. We can certainly try and remove those from the source, as well as actually removing them from the body.
And how long would it take to move them usually?
It really depends on the individual. It really depends on their age. It really depends on the severity or the level of exposure as well. It probably needs to be 6 to 12 months.
Yeah, but that's
and we want to do it in a safe way. We want to do this in a slow way, so that we're actually not causing any more side effects or issues. Because what happens with the heavy metals generally is that maybe our bodies are really smart and clever, that if we have these heavy metals like lead and mercury, arsenic, aluminium, etc., roaming around the body in the blood, it's going to cause a lot of damage to different organs and tissues and the brain. And that's part of the problem with the heavy metals, that many of them are what we call neurotoxic, meaning they're toxic and damaging to the nerves and the nervous system and the brain. Hence why they cause so much of an effect to brain function and moods and behaviors. But our bodies are really clever that that we don't like to have these heavy metals roaming around the body all the time. So the body will actually push these heavy metals out into different tissues in the body to try and get rid of them out of the bloodstream, so they're causing less damage. So sometimes the heavy metals get pushed out into the body fat, for
Yes.
a fairly benign tissue, and it doesn't have such a the heavy metals don't have such an effect on the body fat. Or the heavy metals go to the hair, in which case we can test the hair and we can see what levels there are. Or unfortunately, the brain is another area that the heavy metals can get deposited to as well. So we can find what those heavy metals are, and then very, very safely and slowly detox them. But I would always say that even though if we find that there's heavy metals there, and it's really, really important to safely and slowly reduce them and detox them, it should never be the first thing that gets done.
Okay. Yep.
I always find other metabolic dysfunctions, other nutrient deficiencies that are really affecting the other body functions, like including the body's elimination pathways or detox pathways. So we really need to work on finding the causes of those dysfunctions and fixing those first.
So we're talking about gut health. Do you think that's the first
The
thing
gut,
initially
yes,
you would consult?
improving gut health. So, for example, the majority of people, especially children with ADHD, would have constipation, which
Okay.
means that their elimination pathways there through the digestive tract are really slow and poor. So we need to again find the causes of why there's constipation there and address and fix that, so we can move those toxins and waste out of the body more frequently. Also, yeah, various organs of detoxing, so the liver and kidneys in particular, may or may not be working as optimally as well. And again, there's a number of causes to those. Like the common one that's often missed would be the thyroid. So the thyroid gland produces thyroid hormones that control the whole body's metabolic rate and function, including of the digestive tract, including of the immune system, including detoxing and elimination pathways, and so much more. So if the thyroid is found to be a problem in someone with ADHD, and actually it's a very, very high percentage, I would say it's probably 80% in my experience, that needs to be addressed as a priority well before we even start doing the heavy metals, the heavy metal detoxing. So it's really important to find those heavy metals and remove them safely, but there's a whole bunch of steps that we really need to focus on first.
So with your you talk about nutrition. I guess you would do some sort of a questionnaire with people as to what the child is already eating, or adult even. We do have adult ADHD.
Sure.
And you would assess, I guess, and make changes to them that nutritionally first before you would. And would you do a blood test as well to assess deficiencies? Or
Absolutely, I'll do both. So I would have a look at someone's food and diet. So, for example, I give people a standard form in the beginning, which is a weekly food diary form to get details of their meals over a period of, say, a week. And so I would analyze the foods and meals, look for potential nutrient deficiencies in their diet, perhaps also various excesses, because it's the ADHD certainly is related to a lot of nutrient deficiencies, but of a number of excesses as well. So I would look for those, and then from detailed questioning in the initial consultation in particular, again, try and find how the body is working or maybe not working, and trying to find other root causes there, and certainly blood tests are a really good way of actually confirming some thoughts, finding metabolic dysfunctions that are actually really common, like I said, like low thyroid function, sometimes low liver function, Anemia is extremely common, and it's one thing that I think is missed by so many people and practitioners. So anemia isn't just all about iron. So we can
Yes.
have an iron deficiency anemia, but we can also have a B6 deficiency anemia, or a B12, or a folate deficiency anemia, and hundreds of others. So it's an anemia generally is about having low red blood cell count and or low hemoglobin levels in the blood, or in the red blood cells. And hemoglobin is the oxygen carrying protein of the red blood cells. So that's the whole purpose of the red blood cells in the blood, is to carry oxygen all around the body, and particularly up to the brain. So the brain consumes up to 30% of the body's oxygen requirements. Even this tiny 2% of the whole body volume consumes nearly a third of our oxygen requirements. So if the brain is not getting enough oxygen because of anemia, and as I said, there's a number of different deficiencies, or different types of anemia. But if the brain's not getting enough oxygen, what do you think is going to happen? You're going to have headaches, you're going to have migraines, you're going to have changes to moods and behaviors, you're going to have mental health conditions, anxiety, depression, and even more complex neurological conditions like ADHD and autism and bipolar disorder, etc.
And the traditional method of fixing that is just giving you an iron infusion, right? This is how people, when they're thinking about fixing problems, we're talking about symptom management. This is what people would do. Is that so? Your approach is different. And do you think that anemia is related more to gut health? That if you improve the gut health and the nutrition, that fixes itself, or is there some other mechanism involved?
Yeah, you're right. So what I would do if I find that there's anemia, for example, and in the blood test, if I find that there is a number of nutrient deficiencies, and almost certainly there are, in any case of ADHD or autism disorders, there's always a number of nutrient deficiencies there. Well, again, I'm always trying to find out why, or what's actually causing this. Is this the diet? Is the diet lacking in nutrients? So hence why I need to have a look at the food diary, for example. Or is it the stomach? Is it's I think a lot of the terms around gut health are a little bit vague. Where in do you actually mean? You mean up here in the throat, or the stomach, or small intestine, large intestine? So I want to be a bit more specific and clear. So the problem really starts with, well, obviously the food, and lack of nutrients or excesses, and the chemicals in them. But the stomach is a huge big problem. So if the stomach isn't working very well to digest foods, to break them down and release the protein, the vitamins, minerals, etc., then you're going to have a reduced absorption of those nutrients, which then results in nutrient deficiencies, which then results in nutrient deficiency symptoms. And so it's a big problem. So some people can have an absolutely perfect diet. That would be extremely unusual, or not really going to happen with ADHD. But as an example, I've certainly seen a number of people with other chronic issues that I'd say their diet's absolutely perfect.
Yeah.
But then they're still coming to me in the beginning because they've got a lot of different symptoms and issues going on, and obviously, and usually some very obvious ones that I can see, whether it's a skin issue or weight issue or something. And then I have a look at their bloods, and there's deficiencies everywhere. So the diet is really, really important, obviously, but perhaps even more important is actually getting the stomach working to digest those foods and get the best use out of the food that people are eating. And then if we improve the diet, which we typically have to do with ADHD, and I generally make that as painless as possible. So it might appear to be restrictive, but it's more about replacing things with something that the better options or better choices, or something similar, rather than just complete avoidance, or no, you can't have that. but yeah, improving that stomach function. And I think part of what your question was saying, that if we provide the body with all the nutrients that it needs, and improve the environment that we're in, or that the person is in, yeah, absolutely, we can turn chronic health conditions around, and reduce symptoms, and get people back to health again. And that includes things like ADHD and autism
Which are
conditions.
very related in a lot of ways to this Alzheimer epidemic and dementia epidemic. It's very interesting. You've got one side of the scale, the younger children with ADHD, on the other end, the older people. And what you're essentially saying with your paradigm is it's this toxicity that is the underlying
Well, it's one
problem.
of them.
One of the underlying issues.
Yeah, there's still the genetics. There's the one that we haven't really covered as well, is the stress and trauma,
Okay.
and abuse, and other unfortunate exposures to that children, even children, get go through at a young age, which is really unfortunate.
Oh,
Again, that doesn't apply to everyone with autism or ADHD, but it certainly does for a lot of children. And it could also be partly why there's more adults being diagnosed with autism or ADHD in later in life as well, because of this. The chronic stress is sort of building up over time, and perhaps you can say that stress is a level of toxicity as well.
mm.
But it's a different sort of slant on it. But certainly, the toxins and chemicals, stress and traumas.
So
Uh,
what do you think about these diets, these gluten-free and lactose-free diets, dairy-free diets? I've heard that, a lot of parents say on the forums and autism and ADHD forums, they eliminate, the red dyes, but often they do eliminate gluten and dairy, and they find that there's some sort of symptom release. Obviously, it's not going to correct the underlying issue, but is that something that you recommend as part of the diet, or you don't?
yeah, I do, because for a couple of different reasons. The uh, gluten and dairy foods, in some people at least, maybe not everyone, but in some people, um, cause inflammation.
Okay.
And inflammation really just is a normal immune system response to an injury or an infection. But what we don't want is what we call chronic inflammation or long-term inflammation, because this can progress symptoms into a more complex or a more chronic state, and contribute to more long-term health conditions. Uh, so that inflammation can also be affecting the brain. So we often term this as neuroinflammation, meaning related to the nerves or the nervous system. So things that can affect the brain function, and cause inflammation on the brain, do include uh, dairy products and/or gluten related products. So wheat, rye, barley, for example, um, are the main foods there. But also, with regard to those grains in particular, well, they're very high in carbohydrates, and high carbohydrates in the body get turned into glucose.
Yeah.
Glucose is a major stimulant to the brain, and also to affect brain function, but also high blood glucose becomes quite oxidative, or causes a lot of oxidative damage, or free radical damage, or oxidative stress, if you want to call it that, all the same thing. And again, that the brain is the most susceptible part of the body to inflammation and oxidative damage, and obviously the heavy metals, and the most susceptible part of the body to anemia as well, and lack of oxygen. So a combination of all of these things is going to massively affect someone's mood and behavior, and mental health. So we want to try and reduce, especially in the beginning. Look, this is not necessarily going to be the plan forever, but certainly in the beginning, to get the best bang for buck, really.
Yeah.
is to reduce the things that in the diet, but in the environment as well, that also cause inflammation and oxidative damage to the body. So at least in the short term, in the beginning, in the treatment plans, yes, we probably do need to reduce dairy products, and or replace them with alternatives that perhaps are better, or that are similar, perhaps better, or that not causing those issues. But introducing other foods, or that perhaps more nutrient dense, because that is an issue with the gluten containing foods and grains in general. They're not particularly nutrient dense. They contain a number of anti-nutrients in them, and other binders that bind to various minerals in the meal if we have it at the same time, and can stop the body using those. So they're really not the healthiest type of foods to have anyway. And
So we're looking at a very basic diet, would you say? Obviously, no processed food, no soft drinks, no juices, no gluten, dairy. I guess it could be quite terrifying for a
I
parent
guess it
coming
does,
to you all of a
especially.
sudden, and the child would react to that because they've already got ADHD.
Yes, yeah,
And then all of a sudden
right.
you're telling them that this is your new diet.
I know, and this is why there's. I mean, it does sound extreme in that way, and yes, the dietary recommendations would probably include that, but not right from the beginning. I would assess how sensitive someone would be to dietary changes, and that's usually with talking to the parents of a child. So we would generally only make one small change at a time
Okay.
in some people. Whereas some children are a little bit, well, not as sensitive, and we can probably do a little bit more, and maybe make a couple of changes in their diet. But sometimes it's a case of really just making one change at a time, replacing that one particular food with something that's similar. Uh,
Yes.
and even to the point sometimes of with regard to dairy or milk, for example, is a classic here. We may even need to, we want to switch someone away from the normal processed milks, to perhaps something that is either
Very
less
accessible.
processed, or more plant based. But you might even need to over a period of even weeks. So, let's say if a child was drinking like a glass or a cup of dairy milk every day, well, we probably want to reduce that. So we might even reduce it by by 25%, and replace the 25% of that milk with something else, and then over another couple of weeks, reduce the percentage of the dairy milk with something else, and over a period of maybe a month or so, we've actually replaced it, but the child hasn't really noticed. So that's one thing that can be done. But interestingly, one of the main blocks of children with ADHD or autism disorders from making these changes is their sensitivity to so many things. So they're extremely sensitive to textures of certain foods, tastes of certain foods, and even the look of certain foods.
Yes.
Why so many of them just don't, why they don't want their foods mixed up. They want it all separated on the plate. It just plays with their senses so much. But it's interesting that there's one nutrient deficiency which really affects all of those senses, and exacerbates those senses to a hyper level. And so by potentially even correcting this, certainly testing for it first, but testing for this particular nutrient deficiency, and then supplementing with this, can actually reduce those sensitivities, and then make it so much more easy for the parents or the person in particular to make those changes.
Is that nutrient deficiency universal across all children, or is it just that particular child's deficiency you're talking about?
They'll all have multiple nutrient deficiencies, but this particular one affects all of our senses, and that is a mineral called zinc.
Ah, yes.
So
And
if
zinc's
we
very
have,
low in the soil now, yeah.
yeah, that's part of the problem. So if our soils are low in zinc, or certainly in Australia, iodine and selenium and potentially other minerals as well, that then becomes a deficiency in the plant, but then a deficiency of us, or a deficiency in the animals that eat those foods as well that we then eat. So the problem gets compounded, and yeah, if we're not, again, being holistic, or the farmers themselves are not being holistic on their farms with regard to what goes into the soil, or what their animals or their crops consume or eat, then the problem just gets worse and worse down the food chain to us as well.
I mean, you're not the only one that talks about zinc, selenium, and iodine. It seems to be very common. So it's obviously out there in the public sphere, and yet nothing is being done about it. I think I had an optometrist years ago, and he was saying that these floaters, my partner's eyes were related to zinc deficiency, and he took some zinc supplements, and the floaters vanished, right? And so he was a holistically minded optometrist. But and it was such a small thing just to take some zinc supplements. And he was telling us at that time that zinc was very low in the soil, and that would have been 2012. So obviously nothing has changed. Similar with postpartum cardiomyopathy in Haiti, there's very low zinc. The incidence of postpartum cardiomyopathy is 1 in 200 there. So there's an issue with how food is created. So what you're saying is that you can change someone's diet, but where are they sourcing that food from?
Exactly. Yeah, and as I said earlier, how well is their stomach or their digestive system actually working to get those foods out, and so that they can absorb and use them. And it's also interesting with regard to zinc. There's two other factors at play here as well. When we mentioned the heavy metals earlier, let's just say someone might be exposed to or have high levels of of mercury or lead in their bodies. Well, part of the problem with the heavy metals is that not only are they neurotoxic and damaging to the nerves and the nervous system and the brain, they cause a lot of oxidative damage in the body, which again affects the brain. But these heavy metals are also antagonistic or opposing to many of the other the nutrients, mainly minerals, but certainly some of the vitamins as well that our bodies need. So, for example, mercury is antagonistic to zinc and copper.
Okay.
So, if someone has high levels of mercury, or even lead's also antagonistic to both zinc and copper, but also iron, as mercury is as well in others. So, if someone has lead and mercury in their bodies, the lead and mercury is actually going to be pushing out of the body these essential vitamins or minerals that we actually need.
So does supplementing these zinc push out the other way?
Yes, it does. That's part of the detox protocol, but that's only one of several parts that needs to be done. We need to do other things as well. So yes, supplementing with zinc can start to turn those heavy metals around, but also, probably more importantly, the zinc, for example, will be used by the body a lot more, because it perhaps would have been deficient for such a long time, and then you start supplementing, the body's going, oh great, I've got more zinc now, I can play with, I can use for so many things. So that detoxing of the heavy metals is like it's going to be way down the priority list, but yes, it can have some improvement or effect there.
So I was going to talk about the medications just quickly, what they are, since so many Australians are on them. I think there's some sort of Senate inquiry into it. And from my figures here, what we have is 3.2 million prescriptions of ADHD medication was issued to 414,000 Australian patients in 2022. an increase from 2018 of 1.4 million prescriptions given to 186,000 people. These are huge numbers, and obviously if the theory here is true, that we obviously have more diagnosis, but if the world is becoming more and more toxic, we're all going to end up with more ADHD and autism diagnosis, regardless of vac status. We're just going to see more of it.
Yeah.
What are we going to do? Are we going to keep on prescribing medication to people?
We can't really. I mean, as I said earlier, it doesn't fix the cause of the problem. And I do go through the medications that people are taking for whatever health issue that they might have, but certainly for the ADHD and autism medications as well. Yeah, the statistics of medications is just insane. Where, for example, there's like an 800% increase in the use of medications in the last 20 years, just for ADHD. The huge numbers. Some of the statistics out of the US are just awful. In the US, for example, children of 2 to 5 years old, 11% of them are on ADHD medications already. 6 to 11 years old, 69%.
Wow, really?
On ADHD meds, and 12 to 17, it comes down a little bit to 62%. So, I mean, the Australian numbers are nowhere near that, but just for example, that's as an extreme example in the US, it's just crazy. But
do we have an indication as to whether children with ADHD medication are more likely to end up on antidepressants and with other mental health issues later on in life?
Yeah, they are. Partly because the medications actually don't address the root causes of the symptoms. So if the medications don't fix the root causes, or their doctors or other therapists don't fix the root causes, then the problem is just going to get worse. It's going to get worse and worse and worse. And then we know that all medications cause side effects, and many of the actual ADHD medications actually make the ADHD symptoms worse. So, or unrelated mental health or neurological symptoms worse. So, for example, anxiety or depression, they're actually not part of the official diagnosis of ADHD, which I just find is insane. But just about everyone with ADHD has depression or anxiety, or both. But it's not part of the the official diagnosis or guidelines. So the medications are known to make moods and behaviors potentially worse. And I think I see this a lot, where so many people with ADHD, they might start on one medication for a while. It might be tolerable for a couple of weeks or a couple of months, and then that loses tolerance. They need a higher dose or more, or the side effects are just too intolerable, and then they get switched to a different medication, which may work in offering some benefits somewhere, but always cause some additional side effects as well. But one of the things that the medications do that doesn't really get identified or looked into very much at all is that medications, because they're changing normal metabolic functions and normal brain function, they cause more nutrient deficiencies. And it is actually known that some of the ADHD medications cause different nutrient deficiencies. So, for example, Ritalin, the active ingredient, sometimes also called Concerta, is the more general name. Ritalin causes deficiencies of vitamin C, vitamin B6, and vitamin B12. Now, all of these two vitamins and vitamin, all three vitamins, the two Bs and vitamin C, are also known to cause increases in mental health symptoms.
Yes.
So the medication does potentially make the symptoms worse, or a comparative medication called Vyvanse. So it's slightly different medication prescribed for ADHD causes deficiencies of magnesium, and possibly others. Now, magnesium is a very calming mineral that the body needs to make the more calming or inhibitory neurotransmitters like GABA and norepinephrine and others, which are really implicated in ADHD. But a magnesium deficiency, for example, causes anxiety. So medications can make things worse in that way. But the Vyvanse actually can make things even worse again, because it actually suppresses appetite, which then makes the people not eat as much, which means they're not getting enough nutrition, and then they get even more deficiencies from that. So that's another issue.
I was just thinking though, I mean, when a parent gets a diagnosis of ADHD, usually it would start, say, I mean, maybe they've noticed something wrong with their child, but usually it would start, say, at kindergarten or at school, and the teacher pulls them aside and says, oh, I think your child's got a problem. They go to the doctor, and the doctor really only has a certain number of things in their toolkit to offer them. Then they get offered medication, and then it becomes medication for life, because there's no pathway off that medication. It's not that you to take it for 3 months and see how you go. So a lot of ways the parent has to, at a certain point, let's say they get a diagnosis, or not even like they get told, hey, your child looks like it's got ADHD or autism. Then they really have to make a decision at that point to which way they're going to go, because if they go the allopathic medicine road, it really only is drugs, and they reach out to someone like you, Ross, and look for a holistic approach to getting both symptom management and a cure. I don't know, we aren't even allowed to use that word anymore.
I was just going to say we can't use that word, but the
remission or something,
well, in general the word cure would mean, and this is the part of the problem with the medical approach, or the reductionist model, or the reductionist approach of the medical system, that there's only one cause for a particular diagnosis or a conditional symptom, and therefore also only one treatment that applies or will work for everyone. So that's the medical process, or the reductionist model, and why the word cure basically implies there's a single treatment that will work for everyone, and that's never going to be the case. So I don't use that word, but I would certainly say reverse. As I probably said it earlier, we can reverse the symptoms, we can reverse the diagnosis. Remission, if you want to call it that as well. Yes. Another word you can use instead, but we can't use that cure word as such.
So they basically end up, I guess, weaning off the medication as they do this program. How do you think that with NDIS there is this tendency to go on a certain pathway, because you get a test and then you get a diagnosis, and then you end up in a certain pathway, and then you get more and more funding to treat this?
So it becomes a bit of a double-edged sword, really. So that so many people do go down the medical approach for a diagnosis, so that that they can potentially get NDIS funding for different therapies and treatments, and that would include what I do. That would obviously include occupational therapy, speech therapies, physio if they're needed for people with ADHD as well, and sometimes they do need those, and sometimes all of them. And so yes, it's a terrible situation perhaps to be put in to decide whether do you want to go down the medical route, which to get a diagnosis, just to get onto NDIS, just to potentially get some funding to pay for ongoing therapies, and bear in mind that if you went down that approach, it's typically going to take months or a year or more, and it's going to take several $1,000s at least to go through your GP, and then potentially a pediatrician, and or a neurologist, and or other therapists to either diagnose or as well. So it's a long-winded process just to do that. So yeah, I do get a number of people who have gone down that road, gone down the official diagnosis for those reasons, and then have been accepted into NDIS for funding for therapists such as myself, to offer treatments and to try and turn things around. So really,
So they will fund you for treatments under NDIS, but they have to go down that first, the medical.
So people can. This is part of the issue with NDIS as well, that typically nutritionists, naturopaths, herbalists like myself aren't given official status as a recommended practitioner for people to see through the NDIS. However, if people have got their own NDIS plan or their own managed plan, they can pick and choose which practitioners that they want. And so then they can say, all right, I want to come and see Ross because he's doing things holistically, addressing the root causes and other things. And I'll just invoice as I normally do, either direct to the NDIS plan manager that they have, and it all goes through that way. Even though I'm not and can never get official NDIS status, like a GP or a physio or an OT, for example, might.
So it must be incredibly rewarding to see a patient come in who has ADHD and go out the door, we'll say, neurotypical child, and be able to function in society without the symptoms of ADHD.
Yeah, it really is. And especially when, certain elements of, the practitioner community and the health industry generally, and certainly medicine, that basically says there's nothing you can do. It's a lifelong issue, and there's nothing you can do other than just take this medication. So yeah, I've seen so many comments, heard so many comments from parents, and often within weeks of starting a more holistic treatment plan, sometimes even quicker than that, of noticing improvements. So the parents or the teachers even, and other therapists actually noticing improvements fairly quickly, and then as the treatment plan progresses, obviously things will get better and better and better over time as well. But even to the point, I've had some parents tell me that their teachers or their other allied health practitioners have said, "Oh, isn't it great to see the medications are really helping to reduce their symptoms," and they go, when they're actually not taking any medications. They don't realize, these other practitioners do not realize that there are other alternatives or options that are.
I didn't realize that ADHD was now a label, that it was a forever label. I always thought, like you've got X and therefore you have it for life. So that means that if someone is labeled ADHD, it's almost like a stamp on their record, isn't it? That you're an ADHD child, you've got this diagnosis.
Yeah, look, it depends on the practitioner you talk to, but yeah, I've certainly heard of a number of GPs or pediatricians say, "Oh, yeah, you've got it for life, and you need to be on the medications for life," which is actually quite interesting because Ritalin, the official information for Ritalin actually says it should only be used in times of high symptoms.
Yeah.
In times of low symptoms, you're actually supposed to stop taking it. And they're also the official information for Ritalin actually says if you don't feel improvements in 1 month, you are to discontinue the medication. So but yeah, there's other obvious, or maybe not so obvious treatments for people. Yeah, it is massively rewarding to seeing those even just those little improvements between
Yeah, I think
one consultation to the next. So,
once people see small improvements by doing small changes,
yeah,
it's then easier to continue with the program and then see larger changes. And before long, they don't recognize the child that they had that came in at the start.
yeah, exactly. Yeah, it's definitely not something that's going to disappear in a couple of weeks or couple of.
Yes.
It is a longer term protocol, sort of similar to what I said earlier about the detoxing and heavy metals. It's likely to be a 6 to 12 months
And I forgot, I
and
forgot to
longer
touch
plan.
on the herbalist aspect of it. Do you give any of these ADHD children herbs at all, or?
Uh, Not all of them, um, because I guess one of the downsides of herbs, if you've tried any herbs in the past, is that let's just say not all of them taste absolutely amazing. Some certainly do, but for the most part, they're a little bit on the average tasting side. But so trying to get an autistic or ADHD child who's got taste issues and texture issues to taste something that is quite could potentially not be so palatable on a regular basis, can be tricky. But then you just don't know. I've had some ADHD kids take some not particularly nice tasting herbs, not necessarily for ADHD. I was thinking more around the parasites.
Yeah.
Some of the parasitic herbs are truly awful. But then they've just taken them, and it could actually be because they're so low in zinc that they haven't got any sense of taste. Like quite literally, there's no taste sensation, so they're actually not picking up on it, so they just down it like it was water. So yeah, everyone's a little bit different. So
So you're doing stool tests for parasites as well? Is that part of
oh no, I don't. No, I don't. I mean, even just going on symptoms, the symptoms and or blood tests, we can see that if someone potentially has parasites. So there's a particular blood test or one of the markers in one of the blood tests which can give an indication. But even just symptom wise is enough. So do we need to spend $400 on getting a stool
Yeah.
test just to
You can assume it.
confirm something that the symptoms are already telling us? No, I just see that as a waste of time and waste of money. So no, I think
But is there a harm to taking sort of an anti-parasitic anyway,
oh
even?
no, especially when there's some uh, uh, better ways of taking them, either in a supplement or a tablet or capsule form, or in homeopathic form, for example. There's some homeopathic antiparasitics that work a treat and really don't taste of anything. So it's
Yes.
the best of both there. So yeah, look, parasites can be a problem for some people, some children, but yeah, there's no harm in
You get a quick, do you find that there's a huge symptom improvement after doing, if the child is open to taking these herbs?
uh, if it depends what the herbs are being prescribed for. So the herbs can be an amazing addition to a treatment plan because I can customize a combination of herbs for different actions that is again really specific for that person or that child.
Yeah.
Um, so I would look at some things in there for helping to sort of balance their their, their mental health, for example. Um, Maybe some antioxidants because of the potential oxidative damage that's pretty high in people with ADHD. And depend on what other symptoms or issues that they might have. So really customize it specific for them. But um, but herbs I see as really just being symptom relief
Okay.
in the same way as medications. So they're really just addressing the symptom. They don't address the nutrient deficiencies. They don't address the toxicities that someone might have. that are actually really causing, the ADHD. So, so herbs can be really brilliant in reducing symptoms and improving organ or tissue functions in the body. They're great for that, but people should remember that they're really just symptom relief. They're not addressing the causes. So I still need to address and treat and fix the root causes as well. And if that's nutrient deficiencies, well, that needs to be like nutritional supplements on top of the herbal. So we're addressing. That's really how I work. As I said earlier, find the root causes, treat and fix the root causes, but also address the symptoms and improve the quality of life and improve how someone's feeling, while we're also addressing those root causes. So the combination of doing both really works very, very well.
And so for lifestyle changes, like, do you recommend, like, do you find that there's symptom relief for children taking up, more exercise in their life?
Absolutely. And I've spoken to quite a number of people around this. I've spoken to a number of teachers as well on this topic. And if you sort of think about it, then there is a huge predisposition of or prevalence of boys with regard to ADHD. So often 300 or 400% more boys than girls would have been diagnosed with ADHD. And one of the teachers that I've spoken to has said that, and I've seen it sort of mentioned elsewhere as well, the boys and males in particular always traditionally were the hunters. They're the ones that have to run and chase and go and catch the food and bring it back to everyone. So boys in particular need a lot more exercise than girls. And so there's that aspect as well, but there's also the aspect that if boys in particular but it doesn't mean that girls shouldn't be doing exercise either. It can be very, very, very beneficial for girls and their mental health too. But if boys and all girls are doing more exercise, it typically means that they're outside. They're outside more in the sun. They're getting more sun exposure, which typically would mean more vitamin D, which is more protective of mental health and many other benefits that vitamin D offers as well. They're getting more sun exposure through the eyes, which is actually then triggering more production of melatonin, which is the sleep hormone. So again, being outdoors and/or from additional exercise, kids are getting producing more melatonin to help improve their sleep, which is a huge issue for most with ADHD, and other benefits from that as well. So, but in these days, unfortunately, schools are a little bit different in what they allow kids to do either before school or during breaks in school. In my experience with my kids going through school and certainly many others as well, it's the breaks are all highly supervised. Sit down, shut up, eat your meals, and none of this running around like a lunatic on the oval like we always used to do. Playing tag or soccer or whatever. It just seems to be so much less encouragement of exercise, and actually, if anything, restriction of exercise in schools. So what happens then if let's say particularly boys are not getting enough exercise, particularly in the morning before school? Well, they've been basically told to sit down, shut up in a classroom for 7 hours a day, and to focus and listen and concentrate and do stuff, where traditionally they're supposed to have number one outside and burning off this unused energy.
Yes.
And so that this actually is contributing to the disruptions and the frustrations, the poor focus, the daydreaming, and everything else in the teachers are seeing in the classroom, because they're not allowing boys in particular to do what they're
They're putting them in an unnatural environment.
Yeah, exactly, and burn it off. And then they're sitting in classrooms with Wi-Fi radiation, which is yet another contributing factor to ADHD in badly lit classrooms with lots of electromagnetic radiation from the lighting and the Wi-Fi, and then on
their mobile phone towers, showering things. So that really just takes us full circle back to the topic of what do you think in terms of prevention? What are the key things that we can do, both individually and society, to prevent ADHD?
Yeah, I mean, when you know what the root causes of ADHD are, and there's a lot of them, then you can certainly reduce your exposure to those, and you can even prevent those, and prevent ADHD from actually happening, or to start to turn it around. So it really starts with someone's diet. It has to start with someone's diet. What are people being exposed to in their diet, in terms of nutrients, in terms of, are they getting enough nutrients? Are they getting too much of some? And that's usually the refined and processed carbohydrates, which turn into glucose in the body, and that can become too much of a stimulant. Or is it the deficiencies, or other toxins or chemicals in the diet? So really focusing on diet should be number one. Getting to more what I would say is just real food. So, meat, fish, dairy, eggs, vegetables, and some fruit. Just preferably unprocessed. Perhaps what we always used to have, certainly in my generation. There just wasn't so much in the way of processed and packaged foods with all the additives and preservatives and everything else. So try and avoid those post-processed and packaged foods, to stick to the just real food, good quality meat and vegetables and fruit, and preferably organic if you can, because if you can then reduce your exposure to the toxins and chemicals that are unfortunately added or sprayed onto your usual crops and vegetables. So try and avoid those if you can. That's really the main thing. Exercise, as I mentioned earlier, your kids really need a lot more exercise than as they're younger. Maybe it's also a sign of current sort of society that perhaps parents are so busy that they're unable to maybe give them that time doing exercise these days, and putting them on to things that perhaps too stimulating to their nervous system and their dopamine functions in the brain. So too much exposure to computers and gaming and technology and social media. Try and restrict those. I know it's probably completely unrealistic to suggest a child shouldn't have any access to those, but certainly try and minimize that if possible, to certain times of the day, so that it's not going to be interfering with their schoolwork, or with their sleep, or with their exercise time.
And obviously avoiding everything that we ingest and inject into our bodies.
Yeah, really have a look at everything that that someone's exposed to, in terms of foods or drinks. Look at the labels on foods and drinks. Get an additive app and put it on your phone. Have a look at the labels on products. Find out what the additives are, and these apps will tell you the types of symptoms or health issues that can arise from consuming these foods. And similarly, look at the washing and cleaning products that we all have, we all use, or we can put on our skin, or get exposed to. Again, many of these washing and cleaning products contain a lot of hormone disrupting chemicals, various other chemicals, and things that cause inflammation in the body as well, and oxidative damage, which can cause a problem. So just look at everything that we are exposed to: food, water,
Medications,
yeah.
those sort of things. Yeah. So
That's certainly not everything, but that's a really good start.
we're basically going back to our natural way of living, and
really, yeah, it's a little ironic, isn't it? We've sort of progressed away from that with so much technology, but also other advances in other areas, and yet we've actually potentially made our health worse.
yeah,
This is not just a problem with mental health or ADHD, but if you have a look at the statistics of chronic disease in Western countries, we're having epidemics of obesity, diabetes, heart disease, so many other things, despite all of these so-called advances in our society or in the health industry. We've still got all these epidemics, and it's really not ideal. So we really should be go back to basics again, go back to what we perhaps used to do, what we used to eat, and then that's perhaps going back, depending on your age, one generation or possibly two, to more traditional diet, more traditional lifestyle, and reducing the toxicities. With regard to again, technology and all radiation, so Wi-Fi in the house I briefly touched on. Well, if you at the very least turn off the Wi-Fi modems in the house when they're not being used, especially at night, but if you can, even better, turn off the Wi-Fi and actually wire up the house properly with data cables through the walls, so that all devices are actually cabled into the wall socket. So you actually not only will you get a faster speed, but you'll actually won't have any of the radiation.
have you found that to be quite a problem for ADHD?
Yeah, absolutely. Yeah, I mean, ADHD kids, as I said earlier, are very sensitive to a lot of things. They're sensitive to, well, any of their senses. So they're very sensitive to noises. They're very sensitive to smells.
Oh,
Sensitive to touch, like different fabrics and clothing, tags on clothes. Everything is just hypersensitive, and in many cases, certainly not all, but in many cases, kids are reacting to the radiation or the EMFs, and that's the mobile phone, that's the tablets with the Bluetooth and Wi-Fi and things turned on, or the Wi-Fi modems at home or in the classroom. That's going to be a tricky one to try and get to turn off.
yeah.
But they're very sensitive to all of these things. So trying to reduce the exposure.
You're basically talking about a lot of children here, I think, that wouldn't have a diagnosis. That
Yeah.
you can, when you're talking in parents groups, this idea of picky food, and then of course the parents are trying to address that with all sorts of various parenting or mental health, psychological means. But in essence, it actually becomes their environment and the nutrition, it all playing out heavy metal toxicity, that we're looking at the wrong root cause. So your parent is trying to, say, address why a child's got a picky diet. It's not because they're being belligerent, right? It's because they've got some underlying toxicity or something that needs to be addressed. What you're saying, I mean, it could just very well be the fact that they've left the Wi-Fi on at the house all day, and that they're not connecting the dots to that particular issue.
Yeah, this is why it's so important to go through, find all of the root causes in each person, because everyone's going to be very different. Not everybody's going to have Wi-Fi modem turned on at home. Not everyone's going to be exposed to that. The Wi-Fi in classrooms, or the poor quality lighting in the home, or whatever the causes are. So it's really we've only touched on some things here.
Yeah, so it's a good chance for me
we haven't gone through, but
to segue the fact that you've got a comprehensive webinar, yes, that people can go to your website, rosswalter.com.au, and I'll put the link up there, but it'll be /adhd.html, and
Correct.
they can get more information and tickets to. It's a 7-hour webinar that puts together your year of research. Is that correct?
Yeah, it's been more than a year. It took a year to actually put
So I'll
together.
put together, yes.
But there's still based on many years of experience prior to that as well.
So it's like a crash course.
Oh, not really. It's not really a crash course because it's about 10 hours long. So it goes into this. It's a fairly recently recorded webinar recorded in separate chapters, just to break it up and make it a little bit easier to follow rather than a whole big 10-hour chunk. But it goes into what actually is ADHD, what it is in the medical sense, but also what it actually really is in reality in a more holistic approach, and comparing the two models of thought. What the issues are with the current or medical approach. So the issues with regard to testing, the medical diagnosis and testing. And I've seen everything from someone seeing a GP, having a chat for 5 minutes, the GP saying, "Oh, you've got ADHD," to like in 5 minutes, to taking a year and a half to 2 years and seeing half a dozen different specialists and costing thousands of dollars. So I've seen everything in between. There's just no standard. That's part of the problem. Where was I going with that?
Helping parents to be able to, is it there to help people?
Yes, so the webinar. So yeah, it's comparing the medical side, but also the more holistic approaches to the medical testing versus the testing that I would suggest or recommend. So with certain blood tests and all the hair test. And I do understand, for particularly with young children, a blood test may not be possible, but a hair test can give a fairly good picture of what's going on, but it certainly doesn't replace a blood test, because there's certain things that we can find more in the blood test than the hair test, for example. And in some cases we might need to do both. But the webinar also goes into, well, what's actually causing ADHD? This is the thing that I've never seen anybody else talk about. What are the causes of ADHD? So we go through all of the causes of ADHD from a year's worth of research and looking at published studies. So everything is referenced. Everything goes back to published studies. So it's not just my opinion on these things. There's hundreds of links to published studies in the webinar. And then, as I say, if we know what the root causes are, we can treat and fix these, and we can even prevent ADHD as well. So there's sections on those, and I think there's some certainly examples and case studies and things in there as well. So
it's for carers as well as natural health and allied health professionals who want
the webinar is really, I tried to simplify everything down to make it be suitable for so many people. So for people with ADHD, so probably not for children, like adults with ADHD, and or parents with perhaps teenagers that are perhaps a little bit more aware and want to find out a little bit more. They can certainly be useful for them as well, but not necessarily younger children. But the information in there certainly is for younger children, for parents, even for teachers who want to find out more about ADHD, what it actually really is in a more holistic approach. Other colleagues like myself, nutritionists, naturopaths, herbalists, other allied health practitioners, potentially counselors, psychologists, if they again really want to find more of a holistic approach, occupational therapists, etc. as well. So I'm not sure if I'm going to convince too many psychiatrists to watch it, but you never know. So it's really for everyone. It's not very complex information. There is a lot of information in there, information. There's like nearly 10 hours, and do get into the more
Controversial.
recent beliefs around ADHD, which I do not subscribe to, and I do explain in the webinar why. So the whole all of the new neuro terms that are being used to try and normalize ADHD. So certain practitioners and people believe that ADHD and or autism are just a different type of normal. And people are just built differently. So and there's nothing to treat, there's nothing to fix, there's nothing we should be actually doing, which I just find utterly insane. Because we know from these published studies that I've got in this training in education, that we know what the root causes are. We know what the things are that can actually make symptoms worse. So if we know that, then how can it possibly be just a state of normal?
Yes.
It isn't. And another thing that they often forget, the people of the pro neurodiverse group forget about, is that not everybody in that neurodiverse group is high functioning. There's some extremely low functioning people, and it's a lot of people have or may have some of the alleged ADHD superpowers. This is why I think that they're trying to normalize it. Oh, we've got great concentration and focus on things when there's a disaster, or when there's a timeline. Yeah, we can really focus on getting stuff done. Well, okay, brilliant. So can other people as well. But then they forget about all of the
Negative
the negative
They
things.
mix it all up. Yeah.
So there's potentially a lot of other neurological conditions, a lot of other really severe mental health conditions that go along with this as well. So, for example, there might be 10 or more percent of people who have been diagnosed with ADHD that just cannot function in any form in their life, and that may have to be basically committed to a psychiatric institution. So is that normal then?
Yeah, especially when they can be helped, right? It's such a tragedy.
Exactly. So I think there's just so many things wrong with that belief that it's just a state of normal. And I do go into explaining all of these new neurodiverse, neurotypical terminologies, and what they actually really mean, and why they're really wrong. And because if we can help someone, we can help to reduce their symptoms, we can help them feel better, we can help them in all aspects of their life. So we can help them in their schooling and or education, whether that's in primary, secondary, or even university. We can help get the best benefit out of their education. We can improve their communication with their family, their friends, their colleagues, or their workmates. We can help improve relationships. We can help improve people's ability to get a good job, and obviously the money and the finances and everything that come with that. Whereas if we didn't do that, you wouldn't be able to get the best benefit out of all of these areas. So,
and then the relationships that person can have, as well as the capacity for relating to other people. I mean, that's such a fundamental part of life.
Yeah, absolutely. So I think there's so many benefits of thinking outside the box, and looking at a much more holistic approach, because it's not just about reducing symptoms. It is actually about turning things around and improving someone's health for the rest of their life, which is just amazing. And
if you can do it with one person, Ross, you can upscale it. It just takes an idea. I hope one day have you got a book?
No, I thank you for the suggestion. I am working on that. I'll be taking most of the information from the 10-hour webinar and putting that into a book. So that will be coming. So if people follow me on social media, on my website. So my Facebook page is my name, so Ross Walter, Nutritionist and Naturopath, my clinical page. I do actually have also the ADHD naturopath.com and .com.au websites as well. However, there's
we'll list it all down there.
Technical issue with that at the moment, and you can't get to it, but I'm trying to sort that out. So that's my more specific ADHD page. So everything will probably more be linked through to there. But yeah, if people get in contact with me there and in that way, I'm happy to help them further.
Oh, just because we do go across Australia, is it possible to do online consultations here? You're not set up for that?
Yeah, absolutely. I've been doing this for as in having online consultations available for many years. I think we sort of had to in the COVID times.
Oh, great.
And I was seeing a lot of people. I guess that's one good thing that came out of the lockdowns and COVID times is that we can people can pick and choose
Yes.
a practitioner that didn't necessarily need to be someone local. They can pick an expert across the country, for example, and see them. It's just as good. It still get the information that I need, and it works very well.
And you can send them the blood tests and whatever hair tests that they need. They can get it done by themselves.
Yeah, we can get them done that way. So
and there's pathologies literally scattered everywhere these days, so
exactly.
Is there anything else you wanted to add, Ross, or close otherwise?
Hopefully quickly. I've got a number of look at perhaps just a bit of a summary of some issues that I have with regard the diagnosis of ADHD or the medical approach, if I may. So it's if anyone under stress, if anyone's going through stress at any particular time, if we did the ADHD questionnaires or went through the ADHD testing, I think we'd all get diagnosed with ADHD in those times. So clearly something's not quite right there, and there's actually no standard for testing anyway. Many practitioners do it all very different. The diagnosis of ADHD is a bit questionable when it's really just based on, for the most part, for most practitioners, just a checklist of moods and behaviors of the head. And the diagnosis ignores everything from the neck down. But everyone with ADHD has a number of other symptoms and issues as well. So an example, there was a study that was just released, I think last week, supports my thoughts on this, that they question the neurodevelopmental or the neuro physiological aspects of ADHD being restricted to one body system, and that being the nervous system of the body, so the brain and nerves and neurotransmitters of the nervous system, when in fact ADHD is a whole body issue. It affects all body systems, and this is why people with ADHD also have sleep problems, why they all have digestive problems, why they all have an immune system dysfunction, hormone issues, often skin issues, food intolerances and allergies are extremely common as well. Lots of environmental sensitivity that we mentioned earlier. So and sometimes more. So ADHD isn't a brain issue. It's a whole body issue. It's an issue of whole body toxicity and or dysfunction. So we need to treat and fix the whole body, and through finding the root causes in each person. The official line of the medical profession says the causes of ADHD are unclear. Well, so many studies say that. So many of the pro medicine and pro medication studies say that. It's completely untrue. We know what the causes are. And the importance of finding the root causes in each person. There's such a reliance on medications, maybe historically because of more recent times, or the thought that medications are more modern than older treatment approaches. So diet and lifestyle and herbs, etc. That's just all old stuff. Or we're doing more modern stuff now. We're doing medications. Really, come on, we can see that the medications actually are not fixing the cause of the problem. We need to go back to more traditional approaches. There's no standard for testing or for diagnosis. There's everything, as I said, from a 5-minute chat with a GP to half a dozen different questionnaires to sometimes full on with MRI scans and
Oh, wow.
CT scans and specialists that you've got to wait a year to see. I've seen everything in between. So there's no standard. But what is probably more important, there's no biochemical testing in the official diagnosis. There's no blood testing. There's no hair test. There's no what's going on in the body, trying to find what's going on in the body, trying to find organ and tissue dysfunctions, etc. So there's no testing that's typically done, but actually should be done because they can give huge clues, as I said, to the root causes and or the dysfunctions that need to be addressed as well. And there's so many conflicting studies on ADHD, especially between the differences between ADHD in children to ADHD in adults, for example. And it's certainly not the only difference. So, for example, many studies would say if you have ADHD as a child, you may grow out of it, and by adolescence or out of adulthood, it's mostly gone. And then you've got other studies which show that the increase in adult ADHD is not related to the ADHD in children. And then you've got other studies which say that if you have ADHD as an adult, you must have had it as a child. And then others that say completely the opposite. It's just insane. The conflicting beliefs and studies and information about ADHD is just unreal. But again, if we go back to finding the root causes, it gives a much better understanding and picture of what's going on in each individual person. I think it's part of the problem that the medical system are trying to find the one thing that's causing it.
Yeah, and a protocol they can sell.
And a one medication that's going to address it, and that just doesn't work. So there's just some of my my summary or my thoughts in general.
I mean, I love your approach. It's a very individualized approach. I think there's got a lot to be said, but the power of the internet is great in terms of getting information out there, but more so to connect people and to connect that expertise to a person's need. And especially people with complex needs, they're going to be stumbling in the dark without some assistance, and I think there is a lot of a do-it-yourself healthcare out there, people being advised to take all sorts of things when they really don't know what they're doing, and because they haven't seen someone who's seen it before. And
I think it's partly a good thing, but they might not get the results that they really want. So there's quite a number of people that are informed a little bit on some of the causes of ADHD and some of the potential more holistic treatments for ADHD. But if they're not perhaps seeing someone that's specializing in this and with a root cause approach, then might not get to finding all of the root causes in their case, and or might not have a complete holistic or treatment plan that's really specific for them.
And
Yeah.
for those without as complex needs, it can be very helpful to know what the triggers are that we've discussed today, and just maybe turn off the Wi-Fi, change their lights, get out in sunshine more, and just see how they actually feel. And obviously, make more plans to have their children have spent less time on technology, get out in the sun more often, and perhaps enroll them in some sports and activities. So all these things are very positive things that come from a discussion like this to encourage people to live a more natural, holistic life. So thank you so much, Ross, for your time today. We will put all the links to your website, rosswalter.com.au, your Facebook pages on our website, as well as in the Rumble and YouTube channel. Just a reminder, everyone, that one of our videos was censored. So that is the one with the bioweapons expert Professor Francis Boyle. So that is only now available on Rumble. In closing, Health Alliance Australia opposes harmful health measures, laws and mandates. It provides educational content that will hopefully inspire you to do your own health journey. Please distribute, as we are heavily censored. Email or message it to your friends and family. You can also help with the algorithm by subscribing, commenting, sharing, liking it on both YouTube and Rumble. If you wish to support our work, you can do so by visiting the donate page on our healthallianceaustralia.org. Also join our free mailing list. We are also active on LinkedIn, so join us there as well. Thanks everyone for watching, and thank you, Ross, for your time today.
Thank you so much for asking me. It's been a pleasure, and I look forward to helping a lot more people.
Yeah, that'd be fantastic.